Most people drive a car, but there are subtle nuances that make one car different from another. And it's the same with addiction. When we're treating it, everybody's treated in roughly the same way, but there are subtle nuances that we use on an individual case-by-case basis to allow that person to grow and change and become the person that they want to be.
Hello and welcome to Wellbeing. I'm Jack Hodgins. Today I'll be discussing drug addiction recovery. We are joined by Toby Lawrence, CEO of the family-owned addiction rehabilitation facility, Arrow Health. Toby is here today to share a little bit about Arrow Health and about drug addiction recovery in general. Hello Toby, and welcome to the program.
Thanks for having me.
What is the optimal time for someone to seek help with their drug addiction?
Good question. The optimal time, I guess, for somebody to seek help is when that individual wants help and wants to change. Anybody that's sort of pre-contemplative and not quite at the stage where they're ready to change their behaviour, change the way they operate within their lives is probably a little bit too early. So the best time to seek treatment is when you want change.
At what point do you usually see people, at what point are they in the addiction when they make that decision? Are they early in the addiction or is it more later in the addiction?
Tell you the truth, they come in at all different points along the plinth of addiction, if we can call it that. So some are very new to addiction, some are very new to the costs and the impact that addiction has on their lives, and some have been in the destructive cycle for 7, 10, 15 years. Unfortunately, with addiction, we at Arrow Health classify it as a chronic relapsing brain disease. So unfortunately, some people, even after having 10, 15 years of sobriety or recovery, as we call it, under their sleeves, they have a little slip and a little fall and they take a step back. So even though they understand, I guess, the addiction mind or the mind of the addict, they still need help, and they come to us and they still need a little bit of a reset, a bit of an opportunity to restart things and get back on the track that they were on previously. So they come through at any manner of stage, early on, right through to people that have had years and years of recovery up their sleeve.
What are some of the common drug addictions that come to Arrow Health?
Well, we treat a plethora of addictions, but the biggest one's alcohol. Alcohol's still our leading issue, both in society and in terms of the clientele, the residents that come through our program and through our detox withdrawal unit. Closely followed by methamphetamine users, and then sort of it steps down to opiate, sort of heroin addicts, prescription pill abusers, and so on and so forth. But ultimately, alcohol and people that use alcohol and other drugs, so polysubstance users, tend to be the people that make up the bulk of the people that we treat.
When it comes to the recovery of those different addictions, are the recovery methods different from drug addiction to drug addiction, or is it like, say, heroin to, alcohol, or is it pretty similar?
This is probably going to garner some discussion, but I guess the way we look at addiction is that we look at the addiction as the same regardless of the substance, and even to a point where we look at things like gambling and the reward pathways associated with sex addiction, with online gaming and so on and so forth. But when we're talking about specifically substance abuse, our program is built around one addict, all addicts, so everybody's treated the same, but it's multi-layered. So we treat people, we take people on an educational behavioural change journey as a group, but on top of that, we work with individuals on what the reality is for them. So you've got to look at it, I guess, through two prongs of attack. There's the group-based, everybody's the same, and then a step up from that is everyone's the same, but what is specifically happening to you? And we look at things like past traumas, genetic components, relationships, both healthy and unhealthy, with other people within their families, their support structure. And they go through a process of doing self-reflection, looking at themselves as an individual, looking at who they want to be, looking at how they want to be that person, looking at how they might get to be that person. And so it's multifaceted, is what I'm trying to say in terms of how we treat it. But there certainly is a collective approach to it, and then there's an individual approach to it. So I've given you a really roundabout answer, haven't I?
So in some ways, it's not one size fits all, but there are the collective and then there's the individual kind of...
That's absolutely correct. I think we could best equate it to everybody. I shouldn't say everybody. Most people drive a car, but everyone's car is different. So, the laws of driving that car generally are the same for everybody, but there are subtle nuances that make one car different from another. And it's the same with addiction. When we're treating it, everybody's treated in roughly the same way, but there are subtle nuances that we use on an individual case-by-case basis to allow that person to grow and change and become the person that they want to be.
How did Arrow Health come to be?
It's a good story. So Arrow Health. So my background, I originally did my undergraduate degree in neuroscience, and I initially took a role working in an organisation doing the psychometric testing, which I don't want to offend anybody, but it was terribly boring. So I left and I ended up taking a role as a management consultant, and I was doing a lot of fly-in, fly-out work. But all the while I was doing this, my brother, Sam, went through a cascading addiction himself. Started off with marijuana, progressed to party drugs, eventually started using prescription pills, moved on to ice, progressed with ice, and finally moved on to heroin. And we went through a number, as a family, we went through a number of private and public facilities in Victoria looking for a solution, looking for an answer. And there was a lot of sort of self-education and self-awareness that resulted in the fact that there were severe gaps. And this was happening over a 12 to 15-year period. So I'd finished my master's degree and was getting rather sick of doing the fly-in, fly-out stuff, and realised that there was a real opportunity to try and help people that had been in our position. Sam eventually got clean, went on to do great things, but there was a real gap in the service delivery and the understanding of addiction in wider society. And the other element that sort of spurred this on was the fact that we knew people that had been touched by addiction, other families and individuals that were sweeping it under the rug. They didn't want to talk about it. So that sort of sparked, I guess, Arrow Health. We started as a day program, sort of a day educational day program. We progressed to a residential rehabilitation program, using the research, looking at 90-day programs, multifaceted programs that sort of looked at things like yoga, Qi Jung, Tai Chi, as well as education, counselling, the physical aspects of it, so looking at the physiology, obviously based on the medical side of things. And then a couple of years ago, we decided that we needed to improve our medical intervention, our medical models. So we ended up registering as a private hospital and having a whole medical staff come on board. And now we run a facility up in Wood End that boasts both the medical detox and withdrawal aspects, as well as a very focused behavioural change addiction treatment program, which is great. I mean, yeah. So that's where we've come from.
Is it hard for someone to ask for help with their drug addiction?
It's difficult because I'm going to give you the answer that no, it's not. We're here ready to talk with them, ready to try and work out what they can do. But I think if I was to take a step back and put myself in the shoes of people looking for help, it is difficult. There's a lot of pride. There's a lot of misunderstanding out in wider society. There's a lot of paranoia in terms of how is this going to be viewed. I've let down my family, I've let down co-workers, I've let down loved ones, I've let down myself. So there's a lot of sort of self-ridicule and resentment towards oneself. So I think that's a lot of baggage. So yes, it's difficult for the individual to put up their hand. And whenever we take an inquiry or I talk to somebody, I say, putting up your hand and looking for help is the first step. And the addiction treatment process is just one step after another. It's every second, it's 1 second at a time, 1 minute at a time, 1 hour at a time, 1 day at a time. And I'm quoting, I think, a book there from the NAAA fraternity, but it just comes to taking little steps forward. And sometimes we take a step back, but it's continually moving forward in an orderly and planned fashion that ultimately leads somebody, hopefully, to where they want to go. So.
You're listening to Wellbeing, where we're discussing drug addiction recovery. My guest today is Toby Lawrence, CEO of the drug rehabilitation facility, Arrow Health. What is the process from the first phone call when they call you up and say, look, I want to undertake help, to when they walk out the doors and they're successful? What are the little steps in between that?
So when they call for help, we give them some initial information about who we are and what we do. If they're keen to find out more, we set up an appointment with one of our counsellors here, and they have a conversation about where they're at, where they've come from, what's motivating them to look for an organisation like ours, and what the reality is of how much they're using and why they're using. And based on that brief conversation, we can work out whether somebody's looking at sort of a detox withdrawal situation, rehabilitation program type situation. They might be looking for counselling or for education. It might be a family member that's struggling to work or deal with a loved one. So, they might be looking for insight from our family counsellor. It might be an organisation that's looking to deal with an employee. So we might be working with our psychologist in that regard, but it'll get triaged. What I'm trying to say is it gets triaged to the right area. And then if we can't help in that vein, what we do is we try and look for either a public or private organisation that could help. So in the case, we get a lot of phone calls from family members who have underage kids, so kids below the age of 18, who are in dire need of help. And so we talk about organisations like YSAS. Prior to the COVID pandemic, there was a group in America that we used to talk about that specialised in children, shouldn't call them children actually, adolescents between the ages of 12 and 17. That's a very difficult area, probably a conversation for another time. But the idea is, the premise is that when somebody rings us, we want to leave them with some information or the next step. They might be with us or it might be with another organisation. But generally speaking, trying to find help in the plethora of addiction treatment services, mental health services is difficult. I know there's things like Direct Line, and Lifeline and other sort of government organisations that do a terrific job with what they have. But when you've got a family member or an individual in crisis, it's a very difficult position to be in for them. And ideally, what we're trying to do is just give them what that next step is. And sometimes it is a referral to Direct Line because they have their whole system about catchment areas and things like that. Sometimes it's just a referral to a GP that we know deals with addiction and deals with it well. It's a case-by-case basis. But we triage it and then refer it off to the right area.
What is the attitude that someone needs to have while they're undertaking recovery or going into recovery?
If they're moving from addiction to recovery, listen, we work with a lot of people from all walks of life. All we ask is that there is a want to change. And it doesn't matter how small that want is. If we can hook into it, we can generally work with them and open it up and use it to get them out the other side. Going through the motions, going through an addiction program to try and please loved ones or mum and dad or family members, it doesn't work. There's got to be a want from the individual to change and to look for something better. And our assessment process, so if somebody wants to come into program, we go through an assessment. We look at what those motivations to change are. We look at what they have in their life and what they're trying to hang on to or what they're trying to create or grow. And we use those factors as motivating tools to keep them engaged, to keep them going. Because no one goes to rehab because they want to. They go because they have to. And it's not our program. It's not for the faint-hearted. It's not let's all sit around and have a wonderful time and have massages and forget about life for a while. It's focused on people confronting who they are and changing them to who they want to be. So, and that all comes from that seed of motivation, that seed of recovery capital that they have.
Overall, in the entire recovery sector, how affordable is it?
It's a good question. It's difficult. We've been doing this now for 7.5 years, being a private hospital, we have the opportunity to use private health funding for people to access our program for the first 4 weeks. After that, if people want to stay longer, there's not a huge amount of funding available. So it's a fee-for-service situation. So when we look at it, on the outset, it looks terrible because it's thousands of dollars for a 60 or 90-day stay. But then when you drill down and have a look at, well, what's involved, and we're looking at 24/7 staff, 24/7 nursing, meals, accommodation, resources, staff that have been properly trained and understand addiction, a program that consists of, we have a wonderful gentleman, he's a Buddhist monk who comes in and does something called Qigong, which has been linked with especially sort of younger addicts as a way of calming the mind and keeping them engaged. So he comes in. So there are all these other aspects, plus insurances, electricity, water. If I could do it for free, I would.
Yeah.
The unfortunate thing is to make it all come together, it's a costly exercise.
Yeah.
And once again, I'd love to have a chat with governments and other industry bodies about it, because the reason Arrow Health is here is because we have the ability to look at individuals on a case-by-case basis and work with them. The public system, once again, does a great job with what they have, but it's limited in the way that they deal with people. There's no, and one of the other big things about private addiction treatment is there is no regulation around it. Anybody can set up a private addiction treatment organisation, which lends itself to a bad reputation. So what we've tried to do here at Arrow is try and be as transparent as possible. But unfortunately, in order to run a concise, focused program properly, as tightly as possible, it still costs money. And so yeah, on the face of it, it does cost a lot, thousands of dollars for extended stays. But when you look at what's involved, it's somewhat akin to an all expenses paid holiday. I don't make that judgment as they're going on a holiday. What I'm saying is the price is in the same vein. But I understand people that ring here, and I'm sure people you've spoken to that believe addiction treatment should be free, and I'm 100% behind that. But until we have people in high positions agreeing with us, we're stuck in this situation.
What things do you think the government could be doing to improve the sector specifically?
Listen, the government, I read the reports and I love the work that they're doing with things like the safe injecting room, and I think they've spent $52.1 million on 900 beds in the Barwon, the Ballarat, and the Hume region, if my memory serves me correctly. But if I was to be fair dinkum about what the government could do, we have to look at what the government's doing about treating addiction, not about the safety associated with the addict. So I'll give you a good example. The safe injecting room, people make the mistake of thinking that it's an initiative for the addicts, the people suffering from addiction. It's not. It's a community benefit. It's getting needles off the street. It's getting people to use substances in a controlled manner and saving their lives, which is a good thing. So I don't want to take anything away from that. It's a good thing. What it doesn't do, and what I haven't been told, is that it actually does anything to treat the addiction. So it's not helping people move away from active using. It's not getting them to stop using or move to a lifestyle of reduced using. Our program is abstinence-based, so we move people from active use into a life of recovery, not using any drugs or alcohol. The prevailing public policy is harm minimisation. And because of my lived experience with addiction, as well as the education and the research that we've done as an organisation, I don't believe harm minimisation is the best policy if we're moving people from active addiction to a life of recovery. So when you ask me what should the government be doing, I believe that the government should be reviewing their public policy on addiction and substance abuse, and looking for opportunities, not just to keep people safe, but to help move them away from the substance abuse, from the addiction. That's what I believe.
You're listening to Wellbeing, where we're discussing drug addiction recovery. My guest today is Toby Lawrence, CEO of the drug rehabilitation facility, Arrow Health. How well does society understand addiction? I
don't think it understands it at all well, and I'm a perfect example. I had a visceral hatred of my brother who helped me start Arrow Health. For years, I hated him. I can hand on my heart say that it was visceral, it was palpable, I could feel it. And I'd done, abnormal psychology, substance abuse psychology as part of my undergraduate neuroscience degree, and I still did not understand it. And it wasn't until he and I, when he was in recovery, he and I went shopping together. which was, I think it was during the Boxing Day sales. I forget why, but we were together, and we'd made somewhat of amends, and sort of I could see he was trying, and that's all I ever wanted as an older brother, is for him to try. Still didn't understand addiction, and this is prior to our health. We were shopping together, and he looked at me and he said, "Listen, I've got to go. I've got to go to a meeting." It was a Narcotics Anonymous meeting at the time. And I looked at him and I thought, sure, he's going to go off and score. And we're down the slippery slope again. And you've got to keep in mind, I used to find him with needles in his arm. I used to find him half comatose. We called the CAT team, called the ambulance. I used to do all of that. We'd have physical arguments. If you've ever seen those, they used to run commercials on ice use where people were punching holes in the wall. That was my brother. So that's what I had to live through with my family. So I was convinced he was going to go and use. Anyway, he came back about an hour and a half later, and you could see he was visibly lighter. The weight had been lifted off his shoulders, and I said to him, "What happened?" He goes, I went to an NA meeting." I sort of asked him a few questions about it, tried to understand it a bit more, and the more I understood it, the more I realised that addiction for him, it wasn't. He made a mistake, and you can scold him as much as you want. He should never have picked up in the first place, and he made a mistake. He was part of a peer group. He used for that first time, but that's all it took. And then he was hooked, and he was off, and he was in the spiral of self-destruction. And once he was in that spiral, and this is where my thinking flipped, he had no choice. He woke up, he described it to me, he used to wake up every morning and all he could think about was getting heroin. And when I think about it, and I thought it, and I remember thinking it at that time, I thought, I've never understood that. I always thought he was making an active decision to go and use every time he went to use. And it wasn't until I had this sort of frank conversation with him in the Foot Locker shop that I think we were in, that I realised that, to him it was like breathing. It was a need. And he was stuck in this self-perpetuating cycle. And I think that's a prevailing view out there in society. I know people on the radio certainly spout the fact that addicts make that choice, they make that decision to use, but it's not the truth. It's not the truth. I'll absolutely happily say yes, they've made a bad decision, but I think we've all made bad decisions at some point in our lives. The fact is that they have that, whether it's genetic, whether it's self-medicative, they have that underlying need to use from then on that creates that self-perpetuating cycle, and that's you can't hold them accountable for. And that is the disease of addiction that needs to be treated. And I don't think that is what's understood in wider society.
How can we make it more understood, do you think? Is it education? Is it what do you think?
Honestly, I think we've got to look at what we've done well. Let's not reinvent the wheel. Beyond Blue have done a fantastic job with depression and anxiety and dropping the barriers of mental health. I think we need to do something in a similar vein. We need to look at it. We need to bring addiction to the forefront and talk about it openly. I gave a presentation with a group of construction workers a while ago, and they were talking about, this sounds a little bit financial, but they were talking about the fact that within any big budget project, they have to build in an amount of money that's a certain percentage of the overall project for defect rectification. And I said to him, "Why is that?" And he goes, "We just have people have off days and they're not concentrating and they don't do things well and they build stuff and it doesn't work." And but I said, "Do you find it's often people that have been that are having family problems, or there's something going on for them that's taking their mind away from the job?" And they said, "Yeah." And I thought to myself, if these groups could bring things like addiction or wider mental health to the forefront and talk about it openly. A chippy could come to work and say, "Listen, I'm really struggling. My son is using ice. I don't know what to do." And there was an avenue to go off and have a conversation so that he could return to work and concentrate and not have to have these defect elements built into the budget of this big project. Because he felt comfortable enough to talk about the impact that the family member was having on him. I think that's what we need to do as a society, is bring it to the forefront. We need to talk about it. We need to champion people that come forward and say that they're addicts and demonstrate how they were and how they've changed. I think we need to look at making things like, but once again, very similar to Beyond Blue and others. We need to talk about the story of addiction. We need to get people out that have been addicts and talk about their story and what it's like. And we need to educate on the real factors of addiction. That yes, people make bad decisions, but it's that feeling of needing to breathe, that feeling that you can't survive without that substance, that drives that behaviour. And I think once that's better understood, there'll be more funding, there'll be more understanding, and there'll be just a greater level of community engagement around addiction and the support of the individual from active addiction to recovery. And I want to caveat everything I've just said with the fact that there also needs to be the substance abusers, the people suffering from addiction. There needs to be a want for them to change as well. So it's got to be 50% from one side, 50% from the other.
In a lot of ways, is recovery something that's not just when they walk out of the door from Arrow Health, but something that's ongoing?
Absolutely. I think we advocate, one thing, because peer support, sort of the NAs, the AAs, Smart Recovery, those support groups are so valuable in the recovery journey. When somebody leaves a program, we do what's called a continuing care plan. So it's a dedicated plan looking at what that person's going to do over the next 12 months. That peer support aspect is critical. So we advocate, I think, and I think this is widely accepted by a lot of facilities, at 90 meetings in 90 days, because it's, once again, getting that routine into the back of somebody's mind that it is a lifelong journey. It just doesn't, you don't just get to go into an inpatient program for a period and you come out and everyone's back to normal. It's a lifelong journey that needs to be maintained. But if done well and correctly, and with very little impact to somebody's life, it can be, truly rich and wonderful.
From here, where do you see the recovery sector going in, say, 50 years?
So I think 50 years from now, it's my hope that addiction, much like other mental health issues like anxiety and depression, become something that, although can affect an individual's life, isn't a life sentence. It's something that can be treated, and it's something that somebody can bounce back from really well.
Well, thank you for your time today, Toby. It was an absolute pleasure talking with you.
Thanks for having me. Happy to talk anytime.
My guest today was Toby Lawrence, CEO of the family-owned addiction rehabilitation facility, Arrow Health. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well. Being wish you well. Being wish you well.